Hey guys, what's going on? Joey Case here, TOPCARE Coordinator. This week's tip of the week. So in the past 2 weeks, we've had 2 national studies come out looking at how COVID has affected student athletes, and frankly, I think how it's affecting everybody. And one of the common themes that shows up is high levels of anxiety. Probably not a huge surprise to anybody watching, but there's a lot of people feeling anxious right now. So I want to talk just for a minute about anxiety. You know, I think when we start, anxiety is something that I would assume everybody watching this video, you've all felt anxious at some point in your lives, right? Maybe you have a big test coming up. Maybe you've got a trip coming up and you're going to be around family and you're worried about conflict. Maybe you're worried about a big game. Maybe you're worried about something that happened 5 years ago. Maybe you're worried about the implications of COVID for that matter. But lots of anxiety going around right now. And when we think about anxiety, to start with, generally, I like to think of it as it's just your brain's alarm system. It's your brain's way of trying to communicate that there's some perceived threat or there's something there that needs our attention. Your brain basically is trying to get you to focus on something that it perceives as a problem. And generally speaking, when we talk about, addressing anxiety, usually what I see, it's one of 2 scenarios. On one, we need to listen to the alarm. We need to fix whatever the problem is. I mean, imagine the alarm on your car went off one night while you're sitting at home. Would you just turn the alarm off and go back to bed? No, you're going to look out the window. You're going to see what's wrong with your car. You're going to try to address whatever the situation is. So on one hand, we listen to the alarm. We try to see what's there. I also think in some cases, the alarm is going off when it doesn't need to. Your brain's pulled the fire alarm and there's no fire. So generally speaking, in terms of treating and working through anxiety, if it's one of those 2 options, I think it's why it's really important to get in front of a licensed mental health professional, a sports psychologist, whatever you have access to really unpack and see what's really going on there, to see which option fits best. But the biggest thing I just want to say in this video is if you're feeling anxious right now, we have data. You are not alone. There's a lot of anxiety going around right now. So again, I want to encourage you with that. Check out some online resources. If you're here on campus, check out our website, contact your trainer, contact me directly. But anyway, the biggest thing is you're not alone. There's lots of people feeling anxious right now. And if you have any questions, feel free to contact me directly. For TOPCARE, this is Joey Case. Go Tops.